everyone, this is Dr. Drizzle, and today we are in Hickory, North Carolina at the Compounding Pharmacy. Now this is going to be exciting for us because we're going to find out what they make here, the types of medicines and who they make them for. And we're going to end up with finding out what skills you're going to need to become a pharmacist or a technician. We're here today with one of my dearest friends, Beth Watson, and Beth is a pharmacist here at the Compounding Pharmacy. So Beth, thank you for allowing us to be here today. We're real excited and all of your technicians are here. Tell us, as we start off, what is compounding?
Compounding is bringing together multiple ingredients to make a medication. So, for instance, you can think of it like cooking in a kitchen. You have multiple ingredients that you pull together. You follow a recipe where here we would call it a formula.
Okay.
And you use multiple utensils or machines to pull together and make something that is useful, whether it be a medication for a person or an animal.
So you talked about the cooking aspect of it. So we know that when Dr. Drizzle cooks, sometimes it doesn't turn out the best because I sometimes skip through the instructions or the recipe ingredients. That can't happen here, right?
No, we have to strictly follow our formulas to make sure that the ingredients, we're using the correct ingredients and that we are mixing them in a certain order so that the medication is uniform throughout the whole preparation.
So you're probably a good cook too.
My husband would not say so, no.
Well, that's okay. Well, Beth, I noticed we have someone back here that is working on some type of medicine. So
yes,
can you sort of talk us through that a little bit?
Yes. She is getting ready to make capsules. So right now she is carefully weighing out different ingredients. Here she has on the computer screen the different ingredients that she requires for this particular preparation. And this is an electronic balance that she is using that is hooked to the computer. So this will give her a correct reading that will actually be captured in the computer for the purposes of checking the medication later on by the pharmacist.
All right, well, Steve, can you come a little closer then? I want you to see this electronic balance. Now, in schools, we do not have electronic balances in every classroom, so they have to be able to read the little figure and make sure it's balanced on both sides. But this is pretty much going to give you the numbers straight up here, right?
It is. It is. And the computer will not allow us to capture any weight that is off by more than 5% from what it should be.
Okay.
So that is another safety factor that is built into the computer software.
All right, I like that. So another question for you that we have is, who works in a compounding pharmacy?
Well, we have technicians and pharmacists that work with us. The technicians, their daily duties are mainly entering in prescriptions. They will also be making the actual preparations for us, and then doing the shipping. You know, we ship out a lot of medications across the state, so they work mainly in getting the medication prepared. The pharmacist will oversee the preparation of the medications, but then everything comes back to the pharmacist to be checked, and they will ensure that everything is correct, that all the numbers do match up. We do a lot of addition, subtraction, multiplication, and division here, and then we're also here to talk with patients about their medications if they have any questions.
So I'm assuming that communication skills are really key in this type of environment. You have to make sure that people can communicate and articulate what they're trying to say, and then you want to make sure that all these wonderful, beautiful ladies here are doing correct measurements and they're having to use those skills correctly. So we trust very much these people that are making the medicines for us.
We do.
So where did you go to school?
I went to the University of North Carolina at Chapel Hill. Go Tar Heels.
Okay, we'll let that one go. Now, did you go there how many years?
I went for a total of 5 years, 2 years undergrad and then 3 years in pharmacy school. I have a Bachelor of Science in Pharmacy and I am a registered pharmacist.
Okay.
Now, most pharmacists that come out of school have doctorates of pharmacy. Those programs tend to be a little bit longer, usually 5 or 6 years, and so from start to finish.
So you really have to enjoy school or enjoy learning, because the outcome is you can work in a place like this and be a pharmacist, right? So we talked about the capsules. What else do you make? If our students are sort of interested in, I'm sure a lot of them have taken medications before, been prescribed from their doctor, maybe even over-the-counter things. What do you make here?
There are typically 3 different types of products that we make. We have non-sterile products. Those would be capsules, oral suspensions, creams and ointments that you would use topically. Another type we make are sterile products. Those would be either injections or eye drops, things that have to be really clean before that they can be put in the body. And then we also have some hazardous medications that we make, mainly chemotherapy capsules for veterinarian use.
Okay, so you did talk about veterinarian use. So we do have medicines here for animals. What would we give them?
Typically it would be the same medications that you would give humans, but they need to be in either lower strengths or different dosage forms, or just simply different flavors.
Right, because dogs like chicken and turkey, and normally my medicine doesn't come in flavors like that.
Right, right. So we have chicken flavor and bacon flavor and fish flavor for our furry cat friends. So,
well, that's interesting. Well, we're going to actually head down to a sterile room and talk about what we wear. So we'll be right back. So we're going to sort of look at what the techs do inside the clean rooms. So what do they wear? Let's talk about what do they wear.
The technicians have to, what we call garb. It starts with hand washing, as she's doing now. She has also put a hair covering on, as well as a face mask. She will do her hand washing for at least 30 seconds. More often it is a lot longer than that. Then she will go from here into the anteroom, and that is where she will put on a full hooded suit with boot covers.
And that's what this is right here.
Yes.
Okay.
And then she will change gloves again to put on sterile gloves.
Okay.
And once all that is done, then she is ready to go into the clean room.
So what is this blue thing right here on the floor?
This is our little sticky sheet. So what it will do is it will catch any dirt on the bottom of shoes.
It sounds like a fly trap.
Go into the anteroom. Because it is a clean room, clean means that it is free from bacteria or fungus that can cause contamination. And so because we are going in to make injectable medications or eye drops, injectable medications are injected directly into the body, into the bloodstream, or eye drops are instilled into the eye, which is a soft tissue, and those things are very susceptible to contamination if the product that you're using is not clean.
Perfect. So you answered my second question. If we don't follow this protocol, we could harm someone, right?
Definitely,
so we want to make sure.
We want to make it as safe as possible, because in the end we're trying to help someone feel better.
Right. Well, we'll come back in just a moment when she's actually inside the room. So now we've just saw Merrick go through the whole process of cleaning up a little bit, and we noticed that she's putting on now that full suit, which is very cool. I'm going to have one of those. But she's getting ready to go into this sterile clean room. What's the difference between sterile and non-sterile?
Well, sterile medications have to be clean. They have to be free of contaminants, which could be either bacteria or fungal contaminants, and that's because they're going directly into the bloodstream of the body or into soft tissue of the body, and those areas are very susceptible to contamination. So we have to make sure that everything, including the personnel that are going into the room, are as clean as possible to prevent that from occurring. The room itself is also a piece of equipment in that it has certain airflow, and HEPA filters that clean the air within that room.
Okay.
And then the hood that you will see is also a piece of equipment that keeps the air as clean as possible. So, so that's what makes it sterile. Non-sterile products are things that we can use for oral ingestion or topical use. Of course, we don't want to put bacteria and fungus into our bodies if at all possible. But those types of things, our gut is better able to handle that type of contamination versus the bloodstream. So that's sort of the difference in those.
Okay. Well, I'm going to let Steve go ahead and look inside the room. She's getting ready to come in. Can you tell us what she's getting ready to do now? What kind of medication she's working on?
She is getting ready to what we call filter or sterilize a medication. It is something that we have. It started from a powder active ingredient that has been dissolved in a liquid, and now and has been put in a syringe, and now it goes into the clean room and goes through a membrane filter to filter out any large contaminant particles that may still be in there. And so we will watch her do that and basically make that liquid clean, and then it will go into a sterile container to be dispensed.
We'll come back in just a moment and watch her do this. So Beth, walk us through what she's doing right now.
Well, right now she is preparing some of the syringes and putting the filters on them so that she can push them through to another syringe. And as the liquid pushes through the blue filters, it will pull out any particulates or any possible contamination, and therefore make that liquid sterile for injection.
So right before she did this, we noticed that she was cleaning lots.
Yes. We have to go through a rigorous cleaning process for our clean rooms. Before any compounding can start for the day, all surfaces need to be wiped down with sterile alcohol. And then at the end of the day, once compounding has finished, they will do another round of cleaning for all surfaces, and including different chemicals that would kill both bacteria and fungal bugs.
Excellent. Well, let's head back to another room right now and see what another technician is working on.
Okay.
So Beth, tell us what hazardous materials are here in the pharmacy.
Hazardous materials here in our pharmacy are typically things that we work with that could be for patients that are treating certain cancers, that for patients who are sick, they are very helpful. They can help heal those patients. But for us who are healthy and handling those chemicals can be very dangerous. So they're things that we need to be very careful with here in our workplace, so that we are not harming our own employees. And we have to take those safety precautions with those.
I totally get that. Now tell us what our friend here is doing.
Leslie here is actually making an eye drop out of serum. She is a phlebotomist as well, and a phlebotomist is someone who draws blood. So she will have patients come in, she will draw their blood into the tubes that you normally see, and then after spinning on a centrifuge, the serum separates from the red blood cells. And so she draws off the serum from the top of the tubes, and then will mix that with sodium chloride to whatever percentage the doctor has prescribed for that patient, and then will dispense those into individual ophthalmic bottles for the patient. Now this is because we are using a patient's blood. This product or preparation can only be used for that patient.
Right.
This is considered a biohazard. So it's something that if somebody else got, would not necessarily be a good thing.
So this is for maybe dry eyes, or I know some of our students have grandparents or parents that have had LASIK surgery, or what, glaucoma maybe?
Yeah. Yes.
So they're using
any type of surgery. It can help to speed up that healing process, especially if you have patients that are already immunocompromised or have some sort of chronic disease, diabetes, for instance, where their healing prospects are not as good as they are for otherwise healthy people.
Okay, and I heard Leslie say earlier, from start to finish, if she comes in here and gets ready to start, how long does that take?
The process could take about 3 hours between actually drawing the patient's blood and then going through the steps that we need to go through to get to the finished preparation.
And again, students, this is very important to think about when you're doing measuring in your science classes and math classes. Precision is so important. If Leslie puts in the wrong amount, it's going to be either not helpful or it could be harmful. Mm-hmm. So making sure that she is doing exactly what the doctor has ordered. All right, well, let's head to another place. So, Beth, we just left Leslie, and she was working with bloodborne pathogens. Now we're actually looking into the hazardous materials room. Mm-hmm. So can you tell us what she's doing in here and why her dress looks a little bit different and why she's wearing a respirator?
Mm-hmm. Well, Lisa is actually working in our hazardous drug room. It is a negative pressure room where we keep our hazardous materials. And her equipment is different than what may be used in other parts of the pharmacy because of the danger of the chemicals that she is working with. She has to wear a respirator mask that will keep all powders and vapors out of, keep her from breathing those in. And so she is now working on making some capsules for probably chemotherapy for veterinary use. Probably 50% of our business is veterinary, and we do quite a bit of chemotherapy prescriptions for animals. We are affiliated with both NC State and University of Georgia vet schools and get a lot of their orders for their patients.
Okay, thanks. So Beth, this has been a very interesting day. I want to just reach out to our students for a moment though and say, I know that sometimes we get tired of learning and then having to test all the time. That's never going to end, guys. In any job that you have, in any position that you hold after school, people are constantly going to be telling you what to do and asking you, are you doing it correctly? So just like our end of grade tests and end of course tests, you guys are looked upon also, and you have to follow rules and regulations. Can you tell us a little bit about that?
Definitely. Well, we, of course, are under the jurisdiction directly of the North Carolina Board of Pharmacy, so there's many rules and regulations that we have to meet with them, but also, too, because we are doing compounding, we also have to follow the rules of the Federal Drug Administration, or the FDA, and so it's very important for us to keep up with all the changes that are going on, which is happening quite frequently with compounding now. But, and you know, we do constant classes here for our pharmacists and technicians to keep everybody aware of changes, as well as just to make sure that we're doing it the correct way.
So you just told me something that they're probably not going to be too excited about. You've already finished school. You've got your degrees, but you are still going back to school and learning all the time. Is that correct?
Definitely.
So you're a lifelong learner. And kids, that's exactly what we're trying to teach you in the classroom. Yes, you're learning things that you may not be as interested in right now, but you're going to continue learning in whatever pathway you choose when you finish school. Beth, this has been amazing. Thank you so much for letting us come in here today. To all the staff here. They've been wonderful. I got a hat. I love hats. I didn't get the duck bill, but maybe I can see one at the very end and get a photo. So thank you so much for joining us today, and Beth Watson from the Compounding Pharmacy in Hickory, North Carolina. We will put up a challenge with this. We're going to talk about how we can compound some chemicals in our science class and make something new with that. So thank you again very much. This is Dr. Drizzle, out.